Hello, this is Jordan from Everywhere Medical. I just want to remind you to like and subscribe to my channel for more content. Doing that supports me and helps me come out with more things, as well as helping me put myself through college. So to start off, today we're going to be talking about the respiratory system. And the respiratory system is what I believe the most interesting system in the body. It is able to use pressure to get oxygen and exchange it with the rest of your body to just provide everything you need to function. So starting off, we're just going to talk about the anatomy. So the pharynx and larynx are going to start off the respiratory tract right at the top right here. And so from your mouth, air moves through the pharynx and larynx, and then it's going to move into the trachea. The trachea is a really flexible cartilage that goes all the way to your lungs, where that air exchange actually happens. So your trachea is going to lead into the right and left branches, which split into the right and left lungs, and then we're going to lead into the bronchi, the bronchioles, the bronchial terminals that are at the very bottom, and then finally to the alveoli. Now, when we get to our final stop, the alveoli, this is where actual gas exchange occurs. Now, it's important to remember this because this will be on medical exams and nursing exams. Alveoli is where gas exchange happens. So just commit that to memory, because that's where you're actually going to get your O2 exchanged. So with this gas exchange that's occurring in your lungs, you're able to oxygenate the rest of your body and tissues. But with the complicated respiratory system, you also run into problems. So there are many diseases associated with this system, and that's what we're going to talk about today. So first off, we have COPD, which is chronic obstructive pulmonary disease. This is important to remember, that it affects the bronchioles, which is different from emphysema, which affects the alveoli. Now, emphysema is different from COPD in a lot of ways, but the best way to differentiate is where they are actually affecting your lungs. Now, COPD has a lot of similar symptoms as emphysema, but it's important to remember a few things. You have to remember what it stands for: chronic obstructive. So you are having this resistance within your bronchioles that's causing you to not be able to get oxygen. So you're going to have signs of increased mucus with this. You're going to have a really chronic cough. It's pretty nasty. If you ever want to look up a video or hear an audio recording of that, it's a pretty brutal cough, and you can hear it. So if you have a patient with COPD, it's something that's important to take note of. And with COPD, you're obviously going to have that chronic obstructive airflow resistance. So these are important to note because emphysema can sometimes seem similar, but emphysema is actually caused by these alveoli and that decreased elasticity. So alveoli usually stretch and flex and then go back down, and when you inhale again, they puff up, and then when you exhale, they go down. But whenever you have emphysema, they're stuck. They're very fibrous, they can't flex, they can't move, and this can be obviously an impairment to airflow. So when we're thinking about these two diseases and how they're going to affect you, they can lead to actually a number of other conditions. So we're going to talk about COPD for a second in terms of these other conditions. One of the symptoms that you're going to see with patients with chronic obstructive pulmonary disease is something called air trapping, which I'll explain. So you're trying to inhale more oxygen to compensate for this COPD, but you have kind of a reserve in your lungs already that you can't expel. That's why one way to help patients with COPD is just to get them to use pursed lip breathing. This is really going to help expel CO2 because it allows the release without taking in more oxygen. But this air trapping is going to cause a lot of problems, and one of the main signs and symptoms of COPD, which is a barrel chest. So their chest is going to be so expanded all the time because they can't get rid of this excess oxygen, which is going to cause hypoxemia from that decreased oxygen, and also hypercapnia, which is excess CO2. So, one second, I want to make sure I spell this right. Hypercapnia. All right. So, these two things are really dangerous because they can throw off the balance within the body. Again, your body's always trying to maintain homeostasis. So, what the body's going to do to try to maintain this homeostasis, since you're having less O2, again, hypoxemia, inside the body, you're going to need to make up for it. Usually, you have red blood cells carrying this oxygen that's coming from your lungs. And that carries the oxygen to the tissues in your body. But since you have low oxygen, these red blood cells are going to try to compensate. So your body creates more. And in another video, we're going to talk about how red blood cells are actually made. But right now, we're just going to say that your body's creating all these extra ones to make up for your lack of oxygen so that it can carry as much as it possibly can to the tissues that are being starved of oxygen because of COPD. So your body is going to be trying to compensate for the lack of oxygen to the tissues, and it's going to create excess red blood cells, and this condition is called polycythemia. So polycythemia is actually, poly you can think of a lot. It's a condition that causes thick blood. Because you're having all these extra red blood cells, your body is having a lot of trouble circulating that blood now because you have so many red blood cells, and it's causing your blood to become thick. So this can cause more problems. One of them I'm going to explain. So you have blood that's coming in through the inferior vena cava and superior vena cava to the right atrium. Now, this blood is unoxygenated and it's coming to the heart to become oxygenated. So, because it's dumping into the right atrium, it's going to go into the left atrium right here, and then it's going to go to the pulmonary arteries. The pulmonary arteries actually lead to the lungs to become oxygenated. But with this condition, that is not really possible. So there's a lot of extra blood being expelled into that system, and it's getting backed up in this place right here, which is called, it's a condition called cor pulmonae. So with cor pulmonae, you are going to experience a ton of problems. So you're going to experience even lower oxygenation of body tissues. You're going to have a backup of blood. There's going to be a lot of pressure right here on this left ventricle, which is also going to cause a lot of problems, including something called right-sided heart failure, which we will go over in in another video, and also congestive heart failure. So you're going to see a lot of problems with these. This is really dangerous, and you can see patients going in VFib and ventricular tachycardia with it, which are both very dangerous and can eventually cause death. Things to watch out for if you have patients with this are certain labs, which indicate heart failure. So you're going to see an elevated BNP, which indicates those stretched ventricles. So it's important to keep an eye out for that, because BNP, when it's elevated, is a sign of heart problems. So keep an eye on your patients that have that lab value. It can be extremely dangerous, especially if it's associated with COPD, because the reason for that is that excess of red blood cells. So with both of these conditions, COPD and emphysema, you are going to run the risk of total respiratory failure, which is extremely dangerous. Obviously, our respiratory system is kind of what gives us the drive to be able to function. And you're going to see a really high respiratory rate. You're going to see a patient in a tripod position. So their hands are going to be on their knees, and they're going to be bending over just trying to catch a breath. They're going to have sternal retractions and intercostal retractions, as well as crackles when you auscultate, just because of that backup of fluid and excess mucus and things like that. So there's a few things you can do to help these patients. At this point, there's not a ton you can do, but you are able to keep them hydrated, which is going to improve the mucus problem that's in their lungs. And also, if you get them to cough, it's going to be able to expel that as well. Adding oxygen is a great thing to do. It's important to be careful to do that with patients who have COPD, because adding an excess of oxygen is going to completely shut down the respiratory system, because since you're being overloaded with O2, you no longer really have that drive to breathe as much. So that's something you really do need to be wary of. And a test like the NCLEX are going to ask you about that. And one other thing is chest physiotherapy. It's going to use a machine to beat on your chest and get all the secretions out. They use it a lot in patients with cystic fibrosis who have a mucus problem. But basically, this is all we're going to talk about today with the respiratory system. Again, if you have any questions, please comment down below. Let me know if you have any more fun facts or any kind of question at all, and I'll be sure to answer it as soon as possible. Thank you again for watching, and I will see you next time.